Lori is our oncology dietitian. We just realized she's about to celebrate her 10-year anniversary with the Cancer Wellness Center. Lori, do you want to say anything else by way of introduction this evening?
Yes, so thank you, Priscilla, and thank you everyone for attending. It's late, so I'm impressed. I'm impressed that you're here, and hopefully you stick with me through the end. Um, but I am at the center part-time. Been there 10 years. I'm always so proud to explain that my role there is part of the team that offers such great services, like soup to nuts, anything you could possibly need to explore to support yourself if you're affected by a cancer diagnosis. So I work there part-time. I see people one-on-one. I do programs like this. If you like this format of Ask the Dietitian, we have one monthly on Fridays, and we pick a topic. And then what I love about Ask the Dietitian is you have the opportunity to kind of ask me anything related to the topic. Sometimes it's unrelated, and we sneak those questions in. So if you're curious to learn more about that, just look on the calendar. The just like this one, we typically record Ask the Dietitian as well, so you can check them out on the YouTube channel. I have it like starred as a favorite in my on all my computers. So and it's not because I like to watch myself, trust me. But I think it's great because if you register and you want the materials, that's great. And then you'll have access to them when you register, but then also too, you can watch them at your own pace, which is, I think, really great. I am a registered dietitian since 2004. Oncology has really been the only specialty I've ever worked in. It's the only one I will ever work in. I just know that for a fact. It's just what suits me. Um, I am board certified as a specialist in oncology nutrition. I just passed my boards last week. Yay, me. Priscilla, do I get a raise? Um, is this being recorded? Yes. But just a little tidbit to share about that. Less than 1% of practicing dietitians have that board designation. So what you get from a board certified specialist like me is someone who really is just experienced, passionate about giving you the knowledge that you deserve to know and keeping you well informed so that you can make decisions. So you'll get that from me tonight. There were a lot of questions that were submitted, I think like 25, which is a lot for me. An hour and a half is a long time for me to talk, but not really. It'll go by very fast. So I'm going to just start the presentation. I have a PowerPoint. I took the liberty to merge some of the questions together because they were sort of similar. So you'll see that too. And then you will get these slides. That's almost inevitably a question. Will I get these slides? You will get them. And along the way during the presentation, I also included some links, and they're in blue underlined font. So you'll see them. So when you get the PowerPoint, you can click on that, and it's going to bring you over to the link. Because sometimes in this type of format, there's only so much time I can designate to answer questions. So I want you to explore and expand on this information on your own time, if you agree. That's helpful. All right, so I will share my screen. I thank you again for this opportunity to present. Hopefully you'll learn a little something from me tonight. And I look forward to being interactive with you. So please do share your questions and comments along the way. Okay, so this is our nutrition and multiple myeloma version of Ask the Dietitian. And what I'm going to do is just basically go through these questions, right? The answers, and then give you my questions to those answers. I like to share resources along the way. And I have some great resources at the end that I'll share. And then if time allows, we'll have additional open Q&A. So I want to start here because I think this is a great place to start. What's the best diet for multiple myeloma patients? Are there foods to avoid? And similarly, what food items or supplements should we avoid and why? It's interesting when I see that word avoid, when I'm working with people one-on-one, we might talk about that, but we explore, why avoid? Is there a concern that they're harming you? And we clarify that in our sessions together. And then we might shift focus towards what to eat And that's the beauty of oncology nutrition, is that there's this emphasis and this focus on how the foods that you choose most often are really going to not only empower you, because only you decide what to put into your body, but these subtle choices will be significant and make a difference for how you're feeling. So the best, I put diet in quotes, during and after treatment. Diet meaning the foods that we eat, right? Not a meal plan, not something that we're on or off, but the foods that we eat regularly is how I'm defining diet. So as you can imagine, it depends. And it depends on your individual circumstances. Every single person I meet with is unique and deserves an individualized and personalized assessment and then a corresponding care plan, right? And no two care plans are the same because there's so much individuality for someone in terms of how they eat, what they eat, why they eat, but not only that, their medical conditions as well. So now, depending on circumstances, the priority will be that that person is nourished, right? If there's ever any doubt that someone isn't nourished for some reason, that's the priority. That's the focus. Those are the individuals that I put to the top of my list when I'm working in clinic here at Endeavor. So I think it's important to point that out, that nutritional adequacy and weight maintenance, that's sort of the priority, especially during active treatment. If someone is undernourished, if they've been losing weight, if they tell me they don't really have an appetite, or if they have symptoms that affect their appetite, we want you to consult your healthcare provider or your care team and ask for that referral to a dietitian. At Cancer Wellness Center, I certainly can help someone with that, but you deserve, if this is your situation, you deserve to have a dietitian on your care team to really work on the interdisciplinary team and make sure all approaches are being considered so that we can make sure you're as nourished as possible. There is a screening tool called the Malnutrition Screening Tool, or MST for short, and it can detect if you are or at risk for malnutrition. So this is an image of it here. It's validated, so it's meaning to say that this has been proven over time to detect if someone is at risk or is malnourished. It's 3 simple questions. It's like as you see, 3 steps. So I have the link there that if you're concerned about this at all, you can take this MST yourself, print off the results, bring it to your healthcare provider. It's scored. So if you have a 2 or more, you might be at risk for malnutrition. So it absolutely would necessitate a referral to a dietitian. Okay, so I just wanted to start with that there. So the other considerations to make is what someone's kidney function is and what someone's bone health is, right? So some of you might be aware of this, that in multiple myeloma, there is acute kidney injury and renal compromise is common, right? So we want to consider that at the time of the assessment. And then also during reassessment, because that changes, right? Sometimes that kidney disease is acute and then it resolves, right, as treatment commences. So then there is might be a need to reassess what is appropriate for someone during that time. Now, if someone has an acute kidney issue, malnutrition is more common, more prevalent in that situation. So that is the time to really consider a referral or a consult with a dietitian. If someone has impaired kidney function, this sometimes is managed with diet restrictions, not avoidance, but just sort of meeting or falling below budget in terms of some of our nutrients. So that includes protein, sodium, potassium, and phosphorus. If you think, or if you aren't sure, I want you to just ask your healthcare provider, is there any diet restrictions that I should be concerned about if my kidneys are affected? Renal diets can be very restrictive, which is why a tailored nutrition plan is best. Some people don't necessarily need a potassium restriction, but maybe could benefit from a modest protein restriction. It's a perfect example of where there's individual approaches in terms of the diet prescription. So if any time someone is on a restricted diet, and especially during treatment, there definitely is a risk that they're not going to eat as much as we would like them to eat, and they could risk nutrition compromise. So just wanted to point that out too. Don't assume that you need restrictions. Of course, just ask your healthcare provider. Now, if someone has bone disease, So this is also very common in multiple myeloma. We see that 75%, I believe, is the prevalence of osteopenia and osteoporosis. So nutrition management will play into that as well. And we may talk about having adequate intake for the bone nutrient matrix of that very important vitamin and mineral is calcium and vitamin D. So we talk about that in assessment as well. Okay. Now, all of that aside, let's say maybe you don't have bone disease, or maybe that's controlled and managed. Maybe your kidneys are functioning just fine. What we want you to do is eat as close as possible to what we call a cancer protective diet. So, first and foremost, that's going to mean eating enough but not consistently habitually eating excessive amounts of calories in order to maintain desired body composition. So we talk about weight, especially following treatment or if someone's on a maintenance drug. We talk about body composition and weight maintenance and weight management because obesity and excessive body fat is associated with the risk for multiple myeloma. So there's a few mechanisms at play there, and we want to control that as best as possible too through a lifestyle intervention. We are going to emphasize a whole food plant-based diet, and I have a couple of slides to talk about that coming up, the ever popular plant-based diet. So what that essentially refers to is eating a lot of whole grain, beans and lentils, fruits, vegetables, nuts, and seeds. Those are really high in nutrients, but also happen to be pretty low in calories as well. Really high in fiber, so they fill us up. They're great for the gut. Lots of reasons why this is beneficial, and I'm going to talk about that. So those are some examples there, pretty pictures. And then we're going to still consume if we want to, right? We don't have to, but certainly low fat dairy and lean animal proteins are part of a plant-based diet. And I'm going to elaborate on that as well. We can also limit processed meat, alcohol, and sugary beverages. When we do that, we're removing some of those calories that don't have a lot of nutrients, right? If you know what I mean. And especially sugary beverages, which are associated with the risk for weight gain and obesity. Now, there were quite a few questions about supplements, and I'm going to answer them. But in general, the experts advise that that during cancer treatment, before cancer is diagnosed, in terms of prevention, primary prevention, secondary prevention, in terms of reducing the risk for relapse, we don't recommend dietary supplements for the most part. There has been no good evidence to suggest that they're helpful. There might be some suggestions, and I'm going to talk about that tonight as well. So these are just some ideas for like plant-based ways of eating, right? So I think you'll agree for meals, they're certainly tasty. They're things that you probably intuitively know to be healthy, right? There's some lean proteins, there's lots of fruits and vegetables, right? It's mostly whole foods, it's not highly processed, right? So I'm just gonna include them there for you to stay. Now, someone did ask, what about snacks? So I really love this image. This is from MD Anderson. I love this. Some of these seem a little childish, but some of these snack choices I think are like really great examples of like non-recipe snacks. So typically, I think as a society, most of our snack foods are the highly processed ones, right? They're the ones that taste really good, are high in sugar, high in salt, high in fat, or a combination of the above. When if we can use snacks as an opportunity to get some additional nourishment in, it's a great idea, right? That is typically an opportunity for most of us. So you see some really straightforward, simple examples of that taste good that you can do and that, are really going to deliver an exceptional amount of nutrition as well. So the question about what to avoid and really like what comes to my mind is not really food per se, because technically most foods can fit in a healthy diet pattern. And I would argue that every day, all day. And that's probably why I'm in oncology, because all foods fit. We find that when we're restrictive and we totally avoid some things, we run into trouble with that. That typically backfires, right? So we know from the research that we can have these, foods that maybe are less nutritious and a little bit more calorically dense. We can have them here and there, right? They fit, especially if we're diluting any ill effects of eating those foods with all of these amazing nutritious choices most of the time. So it really is about this kind of balance, right? When I think about avoiding, I think about supplements. So the one that comes to my mind all the time in any oncology presentation is St. John's wort. If you haven't heard of that, it interacts with so many different medications and so many different treatments. So across the board, I would say we that's like the biggest no-no, no St. John's wort. If you're on Velcade, we recommend avoiding green tea and grapefruit. Hopefully, you're aware of that um, based on your healthcare team and what they've advised. Um, I'm going to talk about how supplements are and how prescription drugs are metabolized. And apparently, there's a little competition here and there. So, there are some of our dietary supplements that get metabolized along the same pathways that our drugs do. And so supplemental garlic, not food garlic, right? We can eat all the garlic in the world. Supplemental Panax ginseng and ginkgo biloba, they may interact with CYP substrates. So I'm going to talk a little bit more about that enzyme pathway. And so we typically recommend avoiding those as well. Milk thistle may reduce the clearance of some drugs because it can inhibit the CYP enzymes. So I think sometimes there's this misconception that milk thistle is going to like help detox and like help clean up our liver, right? When that could be problematic if it's reducing the clearance of some of our drugs. Supplemental antioxidants. I don't know that this applies as much to multiple myeloma, but for the most part, I'm going to admit this person. Supplemental antioxidants, we do advise mostly against, just because the data so far really points in the direction of them being problematic. A lot of times the dose is the poison. And so if you're taking smaller amounts of some of these things, or I would say just antioxidants here, that they might be acceptable. The best bet is to ask your care team, right? Now, supplements are commonly used. So I read recently up to like 80% of our oncology population tends to take a supplement. So that number skyrockets from about a third of those who do not have a cancer diagnosis. So from 30 to 80%, because the thought is that maybe these supplements are needed or required, when we're not so sure that that's the case. Most of the research isn't panning out on that. So because they're so commonly used, we just want to know about it. I can share that as a healthcare provider. I just want to know, because you're probably taking them. We just want to check that they're safe. If they're safe, but maybe not effective, well, maybe it's still okay to take, right? But we just want to know about it. And hopefully you feel confident and comfortable with your healthcare provider that you can have that conversation. All right, next question. I love this one. It got submitted a little bit later, but I had to bump it up to the top of the list because I think it's a great question. So, very popular one is a low carb diet best for living with multiple myeloma. So, I'm putting keto curious on here because keto diet does seem to be very trendy as well right now. And when I think low carb, I just automatically go to keto, right? They're not quite the same. I would say it's almost no carb on a keto diet. But I just tend to think keto, and maybe some of you are thinking keto as well. So at this point in time, we don't have any clinical data that a low carb or no carb diet is beneficial for most cancers, including multiple myeloma. I call it DIY keto because there is like such a community interest, and you can look online, you can find a diet book anywhere we turn. It seems like there's keto products. Keto's everywhere, right? It is not the same as a medically supervised ketogenic diet. It initially was developed to treat pediatric epilepsy. And so sometimes truly, if someone is going to initiate a ketogenic diet, they're hospitalized in order to monitor them. There are baseline labs to be drawn to make sure that it's not contraindicated, because if someone's deficient or has any issue with metabolizing fats in terms of their enzymes, and sometimes that's just an inborn issue, they probably should not be on a keto diet, right? So we just want to check all of that out and take some baseline blood work for someone who pursues a keto diet. I wanted to share this image to kind of clear up any misconceptions about a keto diet. So this is from Charlie Foundation, really great website if you're just curious to learn more. They were founded based on the idea that this keto diet is helpful for pediatric epilepsy. And so in the oncology world, for some people, which I'm going to talk about in a moment, for some people who might pursue a keto diet, we sort of borrow the concepts from Charlie Foundation and some of the knowledge and the takeaways from that foundation. This is the breakdown of macronutrients on a traditional keto diet. If any of you are familiar with macronutrients, hopefully you're still sitting down. But this is pretty like shocking. It's pretty alarming. So hopefully what you'll notice right off the bat is that 90% of the foods consumed, of the calories you consume are from fat. 90%. That's a lot of fat. A surprising 6% on a traditional keto diet is 6% of calories from protein. That's the misconception that many people have, is that it's not necessarily low protein, but it might be. It's really, we call it adequate protein. So they're eating just enough to meet their baseline needs, but any more than that amount, it's actually going to nudge them out of ketosis. So because protein in excess will be turned into carbohydrates on a low carb diet. And then the 4% carbohydrate, that is really not a lot of carbs. So this is a true keto diet. There are versions of it, and there's other ways to sort of manipulate it. I don't have time to get into that tonight, but maybe that's another Ask the Dietitian. But this is a pretty restrictive diet. There isn't a lot of research, and that's because it's very difficult to recruit people to go on this diet when they're on treatment or maybe finish treatment. And it's very difficult to get people to stay on the diet, as it turns out. It is very, very restrictive. People that I've worked with who have been on it struggle. They struggle around the holidays. They struggle around social times when food is around, which is really a shame. I think that's part of what I enjoy about oncology, is really bringing back the pleasure and the social interaction of eating, right? It's such a great thing to celebrate. And so if someone's so restricted, it can become an issue. It also is problematic because it's so filling. When you eat that much fat, it's effective for weight loss because you don't really want to eat a lot because you're so full on fat, right? And so people that I've worked with who maybe couldn't afford to lose weight really had to work and make sure that they were eating enough while still staying in ketosis. So it can be tricky. It certainly requires that medical observation and supervision, I would say. Okay, a little bit more about keto. I can go on and on about this. Here's the only exception when it might make sense to explore a keto diet in primary brain tumors. And that's because brain tumors do not use ketones. So it sort of does starve the brain tumor in a way. And it also has been shown to make them more susceptible to treatment. Good to know, right? Because maybe this is where all of this information about keto is coming from. In that brain tumors, there might be some mechanism where it works, but not in other cancer types, unfortunately. So we have seen in the data that other cancer types, other cancer cell lines can use ketones, which would defeat the purpose, right? And it would make the diet less likely to be effective. Some data has shown that the keto diet alone, not the keto plus treatment, accelerated AML. All right, so that's not multiple myeloma, but good to know that there's enough of concern out there that we just need to know more, right? I don't think we know enough at this point in time. And if anything, this is sort of a cautionary tale. It does make sense to consider the kind of carbohydrates and the amount of carbohydrates you're eating, right? I'm a dietitian, so of course, I'm going to give you the advice that really does make a lot of sense. And we're really getting back to basics here. We're going to try to limit that highly processed food, the sugary beverages, excessive amounts of refined carbohydrates. When we do that habitually, there's not a lot of room for those nutrient-dense, cancer-protective foods, right? And when we do these things habitually, we might gain some weight, we might accumulate some excessive body fat, and that may ultimately put us at risk for some cancer types and other chronic comorbidities. So I think we want to just keep that in perspective as well, right? We can eat some of these foods some of the time, right? And working with a dietitian can help you make sense of all that and in the appropriate amounts and the appropriate timing. Okay. next question. So it's a
Lori,
good set. Yeah, go ahead.
I'm going to slow you down because we had a question come in about supplements.
Mhm.
Somebody here tonight said that they take a multivitamin and was curious about what antioxidants might typically be included in a multivitamin formula, if any.
So great question. And I don't know that I answer it specifically when I get into supplements. So I'll answer it now. And then if it's not a satisfactory answer when I'm answering later, interrupt me again. The strongest antioxidant is vitamin C. So there are vitamin C formulations on the market that are like 2,000 milligrams. That's way too much. If you check your multivitamin supplement label, I want you to look for the percent daily value. And generally speaking, in most multivitamins, it's about 100. Sometimes it's a little more. It depends on the formulation. There's so many products on the market that it's very hard for me to answer a lot of the supplement questions tonight. But this is a good rule of thumb. If it's 100% daily value, you're okay because that's probably what you need. When we get it into like 500%, 600%, 800%, that's excessive. That's a high dose, right? Because that's 500% of what you need, right? In terms of your daily needs. So vitamin C is a great example of an antioxidant. Vitamin E is also an antioxidant. Selenium works as an antioxidant. There's some others. Zinc works as an antioxidant. So we just want to make sure that you're not taking a too high of an amount. Generally speaking, a multivitamin doesn't do that.
Thanks, Lori.
Okay, you're welcome. So here's the opposite of, well, maybe not necessarily, but I sort of think it is. This is the opposite of the keto diet, a plant-based diet, because the plant-based diet is going to give probably 50% of the calories from carbohydrate. So it's really interesting when you think of these polar opposite diet approaches that are very popular in oncology right now. And there's a lot more data for plant-based diets. So I like that this question was asked. So, what is a whole food plant-based diet? I just want to clarify that it's mostly whole plant foods. It's minimally processed. There's an abundance in terms of variety, right? I find sometimes, I know I'm guilty of this, but you get like stuck in a rut, especially if you're trying new meals and going plant-based and doing maybe a completely vegan dinner once a week, and maybe it's the same one day, week after week, and maybe we just want to mix that up once in a while. What a whole food plant-based diet is not, it's not necessarily vegan. They're not mutually exclusive, right? It doesn't have to be vegan. It's also not necessarily vegetarian. It's also not reliant on highly processed, I call them mock versions of animal foods. So they're very popular, right? I'm seeing them everywhere. And for some, it might be a step in the right direction, but we really do want to evaluate the entire package. So, what are some of these highly processed options that are vegan or plant-based? Are they necessarily better? And that's not always easy to answer. A dietitian can help you do that, but we don't want to assume, we call that a health halo, right? We don't want to assume that if a processed food is plant-based, that it's a good choice or a good choice for us. Okay. So this whole food plant-based diet, there's a lot of potential mechanisms at play. This is why we're very excited about it. There's just so much in terms of like eating vitamin C, they're in plant foods, right? So we don't necessarily need to take a supplement if we're eating a lot of vitamin C, right? And generally Americans do, as it turns out. A whole food plant-based diet is probably anti-inflammatory. It is loaded with what we call phytochemicals, and those are bioactive compounds that are only in whole plant foods that actually support our immune system. It's wild. There's so many ways it helps us. It's high in fiber, and it probably controls how much we're eating. So it probably helps us manage our weight. That's what the research says. So these images here are from the American Institute for Cancer Research. I have them included as a resource at the end. This list is like their current list of the foods that fight, as they call it. I think it's trademarked. But it's really great. You can click on each of these foods. You can learn more about their properties, how they have these cancer protective mechanisms, and then some really practical tips about how to incorporate them into your cancer protective diet. So hopefully you'll get a chance to check that out. Okay, so what does the research say? So Um, in terms of what I looked at in terms of the most recent research, I saw this, that plant-based diets are associated with reduced risk for multiple myeloma and multiple myeloma specific mortality. Really good to know. All right. So if we've been diagnosed, we probably want to go plant-based. But what did that really mean? So in this particular, I think it was like a systematic review, and I can give you the reference if you need it. They included plant-based diet patterns. So these are tools that they use. They're called, like, the first one is AHEI, the Alternative Healthy Eating Index. That's just a healthy diet. It's definitely not vegan. Trust me. The AMED is the alternative Mediterranean diet. The DASH diet, if you haven't heard of it, is a great one to follow. The dietary approach is to stop hypertension. So great if you have concerns with blood pressure. And then the prudent diet, which is generally speaking, again, like an overall healthy diet. They are not vegan, but they all sort of qualify as being plant-based because they emphasize a lot of whole plant foods, or at least the recommended amounts of plant foods. So that's the ones that they included in this research study. So that's all it takes. It doesn't take a vegan diet to have the benefits. So really good to know here. Here's how they help in terms of the research study, what they found, and sort of what the authors like discussed, what they theorize are why these ways of eating are helpful. They're all high in fiber. They all give those phytochemicals. They help to lower BMI. They have been shown to reduce inflammation. They reduce insulin levels. They reduce insulin like growth factor. That's a cytokine that promotes cancer progression. And then it increases the diversity of the gut microbiome, which I could talk all day about that one too. So, excuse me, in more ways than one, we're getting all of these benefits from this type of diet. And in oncology, isn't that the name of the game? It's not like we're just going from one angle. We want to attack this from all angles. And so this is really where a lot of the research is only just, I would say, building in terms of the benefits of a plant-based diet. Okay, so I came across this too. This is an active trial. I think they are recruiting. So if you're curious to try it out, I don't know if anyone qualifies. It's out of Sloan Kettering. It's a randomized placebo-controlled study of a plant-based diet versus supplement versus placebo. The supplement that they're using is an omega-3, and they're looking to see what's the risk of those who have MGUS or smoldering, and do they progress to multiple myeloma. So they're actively recruiting. I think it's really interesting. Can't wait to see the results, right? Hopefully we'll get some good news soon. And what I want to share about that, I will in just a moment. What they're arguing is that these plant-based diets are high in fiber, and that the fiber is fuel for the microbiome. And when the beneficial microbes in our gut metabolize fiber, they create what we call a short chain fatty acid called butyrate. And butyrate is super potent in terms of helping to regulate excessive inflammation in our body. So really great to know. And I would argue during treatment, even though your oncologist might say, eat whatever you want, I would argue, why not try to have lots of plant foods? Because you're probably helping regulate inflammation. We know treatment is inflammatory as well as the disease. So why not help to kind of modulate that if we can with our diet? This is a link to the clinical trial right on Sloan's website. And what I wanted to share is that some of you may be thinking, yeah, well, great, Lori, I already have multiple myeloma, but how's this helping me? But a lot of times in oncology nutrition, because it's a young field and we're still learning, we think that the very mechanisms that are in play in terms of reducing the risk in the first place, we call that primary prevention, they're the same ones that are probably at play to reduce the risk for progression or a relapse. So good to know, right? That probably those mechanisms are beneficial across the continuum. And so we're just waiting on that research to confirm that. Okay, but so we want to still apply those very same principles. Next question.
Lori, I got another question.
Okay,
We've
lay
got
it
an
on me. I hope we
interactive.
get through these tonight.
Yeah. So, and first off, just want to put a plug because you have a program about the gut biome coming up later this month. So if you're interested, if anybody here is interested in more information, check out the Cancer Wellness Center website, because Lori will just be talking about that. Just to go back, there was a question about like mechanism of action of like why is it that people want to avoid green tea and grapefruit with Valcade? Are there other teas, coffee that also could have the same detrimental impact?
You know what? I'm writing that down. I think that's a great question. And I don't know the exact mechanism. So I will get that back to you. I think that's a great question. This is
Like
why
the
I love,
why of it, it's just like just don't do it.
right. That's all that's ever in the textbooks, right? And even when I look at package inserts for the drugs, which everyone has access to, like you can look online, sometimes it does explain under the pharmacokinetics or the pharmacodynamics. And this is where a pharmacist comes in. um, it explains what's happening, right? So and sometimes it's in theory. There's just a theoretical interaction, and a lot of it's just better safe than sorry. Okay, but
Thank you,
I'll get
Lori.
that back to you. Yeah, because I that's not quite my wheelhouse, but I can get that information because I think it's good to know.
Thanks.
Yes, of course. Thank you. Okay, so this one's all about protein. So how much do we need, in for general health or as we live with cancer? I'm seeing recommendations based on weight. It feels like a lot, which I think is interesting. I also read recommendations that people with blood cancer could benefit from a vegan diet, right? So now hopefully I've clarified that for you. It looks like based on the data, it doesn't need to be a strict vegan diet. Sometimes that's the information we come across because I think sometimes people misinterpret data or they assume that if something's good, then like the extreme version of it is the best, right? But it's looking like that might be good enough to follow a sort of a plant-based diet, which allows for some of our animal foods, right? And if you are again looking for like numbers, that's where a dietitian can talk with you about that. They're making an announcement about visiting hours. Okay, so so protein. So it's sort of like the darling macronutrient of the moment, right? Everyone's like, oh, protein, protein, we need it, we love it, it's good for us. It's really just necessary in adequate amounts so that we can build our muscles. It's found in every single cell in our body. So protein's responsible for repairing tissue, helping to digest, helping to regulate, like including our hormones. It carries oxygen, right? So it's obviously essential. We do need more protein if we are in a hypermetabolic state. So there's not the only way to really determine that is again talking with your healthcare provider, or if you've noticed you've lost muscle mass without really trying and lost it pretty quickly. That's a sign that you're probably hypermetabolic. Typically surgery, transplant, those are situations where you would become hypermetabolic. And so your need for protein is increased, right? Um, we estimate protein. The person that submitted this question was spot on. We do use weight, but we also use age and activity levels, and we also take into consideration someone's medical conditions as well. So, like for example, if someone has kidney disease, where they have poor kidney function, we might limit protein. It all depends. Experts recommend healthy, so non-cancer related adults consume 10 to 35% of their calories from protein. So there you go. Again, with that classic keto diet, do you remember? It was like 6% protein, kind of low. Dietitians often calculate based on your weight in kilograms. So as that person described, 8.8 seemed like the right amount. Sometimes in clinic here, I go up to even above 1.5. I might go up to 2 or 2.5 for some of my patients who are like hyper metabolic and hyper catabolic. They're losing, and maybe they're, still facing surgery ahead, and we really have to build them up. So I would say a good range is 0.8 to 1.5 for most. Um, if if you're not someone who's hyper metabolic or even concerned about that, I think the better number is 1.0 to 1.2 grams per kilogram per day. And hopefully I'm not scaring the person that asked this question because they were scared at 0.8, right? So here's what those numbers look like. And I just took three weights off the top of my head. And so if someone weighs 200 pounds, they might need up to 110 grams per day. Now, just FYI, most Americans consume about 100 grams per day. So most Americans are, if you're not diagnosed with cancer or on treatment, they probably don't need to consume this amount, right? So they're probably over consuming protein, just like they're over consuming everything. That's sort of what's happening in our country. So okay, good to know. So if you look at these numbers and you sort of have an idea of what you're eating, then you can gauge like how close or not you are to your targets. Here's some numbers in case you needed to know. So you can knock this out pretty easily, right? A 3 ounce serving of meat, like a deck of cards, right off the bat, you're going to get 25 to 30 grams. That's a lot, right? In a pretty small amount. An egg is 7 grams, a cup of milk is 8. Depending on the yogurt or cottage cheese, you're going to get anywhere from 12 to 15 grams. Pretty reliable source of protein right there. 8 grams in your beans and your lentils, 5 grams in some of our whole grains like oats. Oats are like really great source of protein. Some people don't know that. Our seeds, so hemp seeds, pumpkin seeds, pepitas, right? I recommend them often. 7 grams is a pretty high dose, right? 3 ounces of tempeh is about 22 grams. So some of those plant proteins as well are gonna satisfy, I think, our need, right? If you are looking to retain or rebuild muscle, which someone asked that question, I'm going to talk about next, we want to eat the protein throughout the day. We don't want it in like one meal, maybe like a dinner. We want to disperse it, right? So at least two or three, I would say three times a day, we want to make sure we're eating adequate amounts of protein. I'm going to talk about that. The goal would be 25 to 30 grams 3 times a day. These are to the Leukemia and Lymphoma Society. I think they have a great website called Pearl Point Nutrition. Lots of great resources, but they have high protein sample menus with the recipes included. And so you can see, and it's like a few days worth. So if you're looking to incorporate more protein because you're concerned, that's a great resource to check out. Now, so what if you're vegan? Right? Sometimes that's a question. And that wasn't a question, but I always like to expand. So here are some sources of protein in plant choices that are also like pretty great, right? We see that these really add up over time. It does take an effort, right? We do have to be intentional and sort of strategic about adding some of these plant proteins in order to achieve our targets. The one thing I do say about if I'm working with someone who is vegan, that we do aim for variety, sorry, so they can receive ample amounts of each of the essential amino acids. There is one in particular called leucine that is referred to as the trigger for muscle anabolism, meaning building muscle. So dairy is very high in leucine, and often why, if I'm working with someone and they're looking to make sure they're not losing more muscle, they just want to at least hold on to their muscle, or they're part of a prescriptive program and they're using some weight training, we may talk about incorporating some of those sources of dairy because of that leucine. And that leucine specifically seems to tell our muscles to synthesize, which is great. If someone is vegan, again, we might recommend corn because it is a good source of lysine as well. Not as high as dairy, but it does provide it. So this I took off of a really fun website. It's actually a dietitian who is like a strength training. And this list here, now I know it doesn't have portion sizes, but they're reasonable. This provides 160 grams, these choices here. Now it's intentional, right? There's a lentil pasta. There's tempeh mixed into the lentil pasta. The tofu scramble also has probably a higher protein toast, whether it's wheat toast or maybe like a sprouted seed toast, which really kind of gives a good amount. Chickpea and quinoa salad, and then the soy yogurt on the side, right? Peanut butter toast. It starts to add up. So I think it's easier than we might think. Okay, so vegetarians can eat enough protein, and vegans, right? If you follow this link, it'll take you to a practice group of dietitians in the vegetarian space. And they have lots of great tips and pointers. Again, more lists about the plant protein sources and how much protein in terms of grams we find in servings. So if you're curious to learn more about that, I invite you to check it out. So, what are the healthiest proteins? Lots of protein questions to consume. Again, I think it depends. And I started to talk about this with the last question. If our goal is to build muscle, there's some great research that 65% of the total protein we're eating needs to come from animal sources. That's based on some expert consensus opinion. I think in time it'll build, and I think that will still pan out in time. And that's because if that 65% amount is reached, that seems to be, according to the research, the amount that saturates our muscles with the right amount of amino acids that are necessary to build muscle, right? And sometimes if we're not eating that amount of animal foods, then we're not reaching that threshold. Okay. Otherwise, if your goal isn't to build muscle, like you feel like you're good, you're just kind of coasting along and maintaining, and you feel like you're doing well, I would encourage a variety of proteins from both plant and animal sources. What happens when we eat plant foods are that we can get the protein, right? Especially if we're pretty intentional about it, but we get the bonus of extra nutrients and extra compounds that might provide some cancer protective properties as well, um, including fiber, phytochemicals, and antioxidants. I do, and I touched on this with the last question, I do encourage variety, right? So I would say that we look at plant proteins in three sections: beans and lentils, whole grains, nuts, and seeds. They're all good sources of protein in the plant world, but they all have different amino acids. So what we want to do is make sure we're eating them and getting variety from each of them, right? Because then we're getting enough of all the different amino acids. We don't have to eat them at the same time. We once thought that, like beans and rice, as long as we're eating them relatively within the same time frame of a few days, we're going to probably be okay in terms of eating the amino acids we need. I share this because, again, I think like most people I work with, and guilty myself, I tend to eat the same things over and over, right? And so what we want to do is think about all the different beans, all the different whole grains. There are so many to explore, and we're so lucky we have access to it. So we want to really tap into all the options we have and try to diversify our choices regularly. Um, and then including our lean and low fat versions of animal proteins, right? They're okay. We don't have to be afraid of eating them. We see from the research that in smaller amounts, they're okay to consume. In fact, they're going to probably be beneficial in terms of supplying us with a quality protein, but then also some of our micronutrients, right? Like B12 or zinc, iron, all things that are important as well, in terms of a total diet. Okay. And this is sort of continuation, right? So can you replace, but not maintain? We want to replace muscle through that you've lost through chemo and stem cell through proper nutrition and exercise. We think so, which is really great. It's so exciting. So this is an image from the expert consensus group that I was referring to before. They really are, they're paving the way in terms of this area of oncology nutrition. And I'm really excited. I'm like so tuned into the work that they're doing because I think it's needed. So what you see on the image here is on the left side, these are the things that really, really take its toll on our muscle health, right? So some things we can't do anything about, like aging, right? Or inactivity. Maybe we have fatigue, or maybe we have some side effects from our treatment that cause us to be inactive. Maybe we're getting a treatment that's inflammatory. Maybe we are going through menopause or postmenopausal, and so we're having some changes to our body composition. But there are some things we can do, right? And so that's where we shift towards the right side of the image. And what seems to be the most compelling in terms of the data that seems to confirm that this is the case is that we're going to look to first and foremost satisfy energy needs. So that means calories. So that's another brief estimation, 25 to 30 calories per kilogram per day. And that's because if we don't eat enough calories, the protein that we eat doesn't get used for what we want it to be used for. and it gets used for the calorie needs because our calorie needs are really like fundamentally essential to keep us alive. So if we meet our calorie goals, great. The next step is to try to meet our protein goals. And so for muscle synthesis, is what this question is asking, we're looking for 1.2 to 1.5 grams per kilo per day. Okay. Now, they are looking at some of these other modalities like fish oil or some of the amino acids like leucine I mentioned earlier. There's less data to support this. So it's really, maybe I need to do an update in like 6 months from now. But we don't have as much data. It looks like it might be interesting, but we don't have, again, it's not as strong of data as we have for energy needs and protein. There's also some data about vitamin D, and I'm going to talk about that later on. It is something that I do recommend for most of my individuals with multiple myeloma that they assess. And we do want to have at least 600 to 800 units per day. And what might be available in a multi or multivitamin supplement. Now, of course, this goes without saying, I think we have to use our muscles, right? If we want to build them, there needs to be that strength training component. That is not my wheelhouse, but this is my understanding is that it has, obviously, it's beneficial for so many reasons. It may increase muscle mass, also may help just in like functional wellness, right? To improve balance, reduce fatigue. It makes it easier to do our daily activities. A well-rounded exercise program is always best and includes strength training, aerobic exercise, as well as stretching. Another thing I'm guilty of not doing. However, depending on specific conditions or symptoms, each program needs to be individually tailored to each patient, right? So we want to keep that in mind. Discuss it with your healthcare provider. I feel like it needs to be assumed that you can engage in strength training, not you have to ask first if you can. It should just be assumed that you can unless you're told not to, right? But that's not really the case. So we just want to get the go ahead from a healthcare provider and then seek assistance if you're unfamiliar. Is it working with someone who has the expertise within the field of oncology, which there actually are. There's certified trainers out there that are experienced only in oncology. Cancer Wellness Center certainly has resources to explore that you can explore for yourself, really at your own, again, at your own pace. Sloan Patterning seems to be a reliable resource for me. They have a great website in terms of information, but then also like videos and additional links. So when you click on this, you'll see all about activity and exercise and the different types and recommendations for it, how to go about pursuing it during and after treatment. Okay, really helpful, I think. I would use it for myself. It's so great. Okay, next question. Diet to promote reduction of inflammation. Should it include turmeric? And if so, at what daily dose and in what form? Really great questions. Okay. So the anti-inflammatory diet, first and foremost, I like to clear the air with this one. It's adequate, but not excessive calories. Did you know that? So if we overconsume calories above and beyond what we need, it's going to be inflammatory. It's causing the body to do more than what it really wants to do, which is wild to me, right? So we don't, it doesn't mean like a weight loss plan where we're eating less calories, but we just want to relatively fall in line with not over consuming excessive amounts regularly. I like to share that right off the bat. Looks like anti-inflammatory diets, as I shared earlier, are those whole food plant-based diets, right? So lots of different options there. Is it a Mediterranean one? Is it pescatarian? Is it lacto-ovo? Is it flexitarian, where it is what it sounds like? You're flexible, you're a flexible vegetarian, right? You sometimes eat vegetarian, sometimes you don't. Um, Certainly one of the most potent compounds are omega-3 fats. So maybe you're familiar with this. Our fatty fish like salmon, mackerel, anchovies, sardines, herring. Those are the fatty fish that are highest in omega-3s while being lowest in mercury. So great choices there. But plus the plant sources are our flaxseed oil, walnuts, and chia seeds. Great sources of omega-3s. So I recommend really like fatty fish a couple times a week. If someone's not a fan, could they eat these plant sources every day? Because then we're going to eat enough omega-3 fats. Lots of herbs and spices, especially turmeric, ginger, and garlic. They seem to be anti-inflammatory. So here's like a couple images again. We have a left and a right side here. So I guess you can imagine which ones are going to be a little more pro-inflammatory. And again, in excessive amounts, I see sugary beverages, I see burnt meat. It's not really burnt. I see processed meat that's encased. I see alcohol, which is technically pro-inflammatory. I don't think the bread's pro-inflammatory, but maybe we'll call it a refined version of one. Whereas on the left, I see a lot of whole plant foods. I see the fish there. I see the turmeric there. I think that looks like turmeric root. I see some healthy fats, berries, all anti-inflammatory. I don't want you to think in like isolation that only turmeric is going to help, only omega-3s are going to help. You want to accumulate the anti-inflammatory effect of all your choices. And that's the best way to go about it, right? So the more of those anti-inflammatory foods you eat regularly, that's how you tip the scale, right? And when you're eating a lot of those foods, it affords the opportunity to still have things like steak, right? Because yeah, it might be a little pro-inflammatory, but not enough to tip the scale because you've already had so much of those anti-inflammatory choices. Okay. Hopefully I'm explaining that okay. Anti-inflammatory diets, as I shared, whole food plant-based diets, they're minimally processed, those omega-3 fats, or lots of herbs and spices. If anyone's familiar, Dr. Weil is a integrative physician. He's down in like Arizona. He's been in practice forever. I feel like he doesn't age. Every picture I see, he looks the same. But he's been talking anti-inflammatory for a long time. Back when we used to share pyramids for our nutrition recommendations, which we don't really do anymore sake of tonight, and I think for the sake of pursuing an anti-inflammatory approach, I think it suffices. I think it's a great way of thinking of this is the foundation of my foods. These are the foods I'm going to try to eat the most often. When you go to this website, because you can again click on that link, it'll pull up this pyramid and it's an interactive pyramid. So you can sort of like click on the vegetable one and it'll go through like which vegetables, why are they all great? What do they have that are anti-inflammatory? And so on and so forth. My only criticism of this particular pyramid is that, it looks like they're recommending supplements every day. I don't know that I buy into that. Obviously, the green tea is something you want to make sure if you're on Velcade, not to consume. And then the cooked mushrooms. Again, I'm not really sure why that made this pyramid. I think it was a thing at the time, but I don't think that there's anything, special about what's in mushrooms that are anti-inflammatory. I would say they belong in the vegetable group, right? Just alongside all those other great choices. Okay, so hopefully that's helpful as well. All right. So turmeric, because the question asked about turmeric. So curcumin is the compound responsible for its anti-inflammatory properties. That's what gives it that burnt orange color, that beautiful color. Turmeric, the root itself, only contains about 2 to 9% curcumin. Now, when we take it out of the turmeric and put it in a supplement, now we got 95% curcumin. So if you're looking for curcumin specifically, probably the supplement's the better version. In addition, supplements that have piperine and taking the supplement while you're eating something that has some fat, maybe an anti-inflammatory one, like maybe the salmon or maybe the flax seeds or the walnuts, that's going to help maximize absorption as well of the curcumin. Here's the thing though, supplements are not regulated. Turmeric has been identified as being a potential source of lead. So if you're not someone who wants to add a lot of extra lead to your body, I would just vet the supplement. There's databases that dietitians like myself or some other healthcare providers can help you find, so that at least like there's a little bit more assurance that they've been third party tested and that maybe they don't contain the things that they shouldn't contain, right? If we don't want to take turmeric or curcumin if someone is on a blood thinner, is about to have surgery, has gallbladder disease. So curcumin causes gallbladder contractions. So if you have gallbladder disease, gallstones, or at risk for gallstones, I would hold off. Talk to your healthcare provider first, or certain types of chemos. We recommend avoiding that curcumin. If you want names, I'll name them. So it's camptothecin. I always mispronounce that one. Doxorubicin, cyclophosphamide. We typically recommend no turmeric with those. All right. So if you wanted to know, because maybe you don't fall into that category, 500 milligrams twice a day has been shown to control the inflammatory symptoms of osteoarthritis and rheumatoid arthritis. So if you had one of those conditions and you were looking to improve the symptoms, maybe the pain, the joint stiffness, that has been shown to be effective as a remedy in terms of those two specific conditions. Does that help in terms of knowing, will it reduce total body inflammation? Probably not, but that's not been studied yet. So we don't really know the dose. However, I think that's a kind of a good rule of thumb. Like, okay, that probably is anti-inflammatory, that amount, right? Now, just for your information, a teaspoon of ground turmeric is anywhere, in terms of my understanding, anywhere from 150 to 200 milligrams of curcumin. Wow. Cool. Right? Really cool. So this is where like sometimes that spice rack, if it has turmeric in it, is a good thing, right? Like maybe we don't worry about the whole food plant version of turmeric, but the spice rack is a great choice for us. So imagine if we had a couple teaspoons or 3 teaspoons a day of ground turmeric, we're probably reaching that number, right? We're getting close to that number. If you're like me, you might not love the taste of turmeric and you might find it hard to squeeze into things. Or maybe you're not, and maybe you're just really fond of it, right? And maybe you could shake it on anything. But I do find it's not as easy to add to the diet for a lot of people I work with. So we get creative with it. And that's, again, where a dietitian can help. Keep in mind that even if you took this amount of turmeric, does that really influence the overall state of inflammation? Especially if we're not considering what else we're eating or not eating, right? Maybe we're eating excessive calories. Maybe we have no omega-3s in our diet, right? Maybe we're not eating a lot of greens or fiber. Fiber is anti-inflammatory as well. So we want to keep that in mind, right? This balance, this thing of like what we do about all of these choices, put it into context, right? The turmeric will help, right? But the other stuff has to be there, right? Hopefully I'm explaining that okay. And then those pro-inflammatory foods, because sometimes people ask me about them. It's the highly processed ones, right? So it's the highly salty foods, sugary beverages, fatty foods, like those saturated fats, right? So from animal foods like butter or full fat dairy, those tend to be pro-inflammatory. And in excess, if someone's not eating a lot of anti-inflammatory foods, over time, years, that could become pro-inflammatory in the body. Do we have a question, Priscilla?
Nope, we're all good.
Okay, thank you.
Well, I should
Okay,
say we do have a question, but I'll wait till you get to the end because it's its own topic.
okay, cool. I'm gonna move pretty quick because I see the time. All right, so does time of day impact the absorption of nutrients? Great question. So I don't know if this is what it was referring to, but circadian rhythm. So there's something called chrononutrition. It's the timing of our food intake in relation to our circadian clock or clocks. It's a function of our bodies that controls all of its biological activities. It includes our wake sleep times, metabolism, our energy levels, our body temperature when we feel hungry. So lots going on here. It's all driven by circadian rhythm. And research suggests that habitually eating outside of programmed eating windows may influence our circadian rhythm and not in great ways. So if we if we so historically, I'll probably talk about this. Historically, if we eat when it's dark, essentially, our clocks are turn our circadian rhythm is telling us it's time to wind down. It is time to get sleep. We start to produce melatonin. We start to settle. So all of the things that go along with that are that we're not really looking to digest and metabolize food, right? So if we habitually, and again, this is not just once in a while, if this is what we're doing every day for years, then it can throw off our circadian rhythm. And then what happens is it sort of taxes it so that it's like, I can't really metabolize the way I like to. It becomes less efficient, right? We don't want to overwork this system. Research shows, and we know this from a lot of really interesting social experiments, that eating late at night, so like night shift workers, even if they eat the same exact amount of calories as people that are day shift workers, they gain weight. they eat the same amount. What is that? But that's because the body's just not primed to digest and metabolize food, and it's inefficient at doing it. And so we see this accumulation of body fat and some weight gain in that situation. We know that excessive body fat is linked with the risk for multiple myeloma. We also know that weight management involves so much more than eating, according to circadian rhythms. So I don't want to throw you off. I don't want you to think like, oh my gosh, it's dark out. I know I'm going to eat dinner after I present tonight. So it's after hours, right? But if it's once in a while, it's not my routine, it's okay, right? And there's so much more to the weight management piece that we know of unequivocally that we don't necessarily need to worry about this all the time. But with that being said, it does make sense, and you probably are, this is sort of intuitive. It makes sense to probably eat most of our calories earlier in the day to sort of shift them earlier. In terms of absorption, we do know that calcium, and that comes up a lot with bone disease and bone health for my individuals. Calcium is one mineral that we do seem to absorb best in the evening. And again, it has to do with the circadian rhythm. So it has to do with like the bone resorption is best, according to, I think it's the parathyroid, that is influenced by our circadian rhythms, which is wild, right? So that mechanism I do know. So if you are taking calcium and maybe it's just one and you're taking it in the morning, it might make sense to take it later in the day or right before bed. Okay. What about magnesium? What's best for, is it, what type is best for fatigue? And then along those lines, someone asked what food increases energy. I love those questions. Okay. So magnesium is a mineral that has a lot of responsibilities. It's very busy. So it's involved in over 300 enzymes in our bodies. It's also part of the bone building matrix. Diets that are high in fiber tend to be high in magnesium. So if you're eating a lot of fiber, chances are you're doing okay with magnesium. However, most of us are not eating a lot of fiber or not eating enough fiber. And surveys of the American diet suggest that about 50% of us are not eating the recommended amounts of magnesium. So we might have some suboptimal levels. Um, what we do know about magnesium is that it is effective at doing some things. Certainly effective at managing constipation, if you've ever taken milk of magnesia, or a magnesium oxide supplement, it'll help you go. If you have dyspepsia, and then there's some good data, not like entirely compelling, where we recommend it across the board as part of evidence-based practice, but it does seem that having adequate levels of magnesium can be helpful in managing blood sugars, any metabolic syndrome, helping with anxiety, and some other conditions that I didn't really think related too much to this group. So good to know. Magnesium is one of those minerals that we just need enough of, but we might not be eating enough of it. So how does it help with fatigue? Well, we don't really think it does. In terms of the evidence, there isn't any good evidence there. If someone took magnesium and told me, boom, their fatigue reduced, I'm going to go with it, right? We got to trust that process. But in terms of what we see from the data, here are some of the possibly effective interventions for reducing cancer-related fatigue. If you have age-related fatigue, that might be something else too, right? So some things to think about here. But you see there are some really fascinating integrative modalities that we know of, right? That we actually offer at Cancer Wellness Center that might help address cancer-related fatigue. Certainly, I think almost all of them we offer at Cancer Wellness Center. So nice little plug there. So if you are curious to learn more about that, I encourage you. I mean, the evidence is there. And I share that. I'm a dietitian. If I knew food would work, I would tell you. And in fact, I'm going to tell you in a moment. But this is where it's at. So anytime someone's struggling with fatigue, which is most everybody, right? Everyone I work with, we talk about activity, moving the body, using mindfulness, and using some of these other modalities. Okay. So good news to share about the nutrition piece of this. There is something called a fatigue reduction diet. It's anti-inflammatory, it's high in antioxidants, and in a couple studies, it's been shown to improve fatigue. Really cool. So this is what it looks like. They call it the fatigue reduction diet. Again, probably they'll copyright it. And it's a lot of whole grains. It's a lot of vegetables, at least a dark leafy green, at least a yellow or orange, and at least a tomato a day. And then two others or more of the above. 2 servings of fruits per day and getting that vitamin C. That's that antioxidant effect, right? and then another serving of fruit a day, and then those anti-inflammatory compounds from those healthy fats, right? The fatty fish, the nuts, seeds, and oils. Where this research has been done, it's a small research group. They started first with breast cancer patients. They wanted to see if it was feasible. So we call it a feasibility study. It was cool. We don't really look at those outcomes because that's not what it's measuring. But then they rolled that out into diffuse large B-cell lymphoma patients who similarly are like on, they're on sort of a plan, they're on maintenance drugs, and they struggle with fatigue. And so they found in this small study, it was a small group, it was like 20 people, but they did absolutely have reduction in their scores of fatigue. So it was done out of Ohio State University. And if you're curious to learn more and see like some stories from some of their participants, I encourage you to check out that link. This way of eating is super helpful, right? And it's sort of like what I like about the information that I'm presenting tonight and in general is that a lot of this checks off people's needs. So you can accomplish all of your needs in a single approach. Sometimes there needs to be some strategy, but for the most part, you can accomplish all of these things without feeling overwhelmed about adding them all together into one approach. Okay, so I promised we would get to this. So this is a little bit more about the food-drug interactions. So the thing with grapefruit is that a lot of our prescriptions are metabolized through an enzyme called CYP3A4. Grapefruit juice can block the action of the enzyme so that we're not even using CYP3A4. And so instead of the prescription getting metabolized, it stays in us, right? So it doesn't get metabolized and the drug just builds, builds, builds. Also, I actually didn't know this. The grapefruit juice can block the transporters of prescriptions so that we clear the drugs out faster. Wild, right? So there's a lot going on here. And here's what's even wilder. The amount of CYP3A4 that we all have varies from one person to the next. So how does that like complicate things extremely, right? So this is why I think it's kind of like don't do it, right? Because we just don't know. We just don't know for a lot of our prescriptions. So your healthcare provider or a pharmacist especially, I find that they are really key players on the oncology team. They can advise if you need to avoid grapefruit or some of the other citrus fruits like Seville oranges, pomelos, and tangelos. Important to ask, okay? So these are graphics that demonstrate that. So sometimes the prescription, the enzyme gets blocked. And so the drug builds in the body. We don't want that, right? We want the drug to just do its job and leave. Sometimes the transporter of the drug gets blocked. So then there's too little drug, it gets metabolized and gets excreted. So then the drug's not even doing its job at all. Now with turmeric, it does interact with alkylating agents. Those are some chemotypes. Anti-tumor anti-metabolites are other chemos, anticoagulants, antiplatelet prescriptions. So if you're on any of those, we don't want to take turmeric. If you're on a drug that is metabolized in the CYP3A4 enzyme pathway, it potentially could interact there, right? And that's a lot of drugs. So that's where it is asking your healthcare provider or even a pharmacist. They are great. Even if it's a pharmacist that's not on your healthcare team, I find that they're very helpful in terms of they know what's happening at the mechanistic level. With Revlimid, green tea and alcohol may increase this. So with Revlimid, I asked the pharmacist here, I asked the question, I was like, what about green tea and alcohol? This was his response. He said that it may increase the risk for cardiovascular effects that Rev already has. If someone's on Velcade, green tea would also want to be avoided, obviously. And so I guess what happens there is that the green tea reduces or decreases the effectiveness of the drug. So there's part of that answer. I still owe more to that answer too. And he advised that he would recommend against taking herbal supplements that have higher doses of green tea and turmeric. I don't know if that's very helpful. Again, I think that that's the tendency in our precautionary principle is that the dose is the poison and that high amounts seem to be problematic. But he didn't give me an actual number, and I don't think that number exists. So it's really hard to answer that question. This is always the takeaway, and this is where dietitians kind of operate. We can have other teas. I think that's what he's assuming, or the tea with Rev. or eating foods with turmeric on occasion, that's not likely to have a clinical impact. He suggested that alcohol in moderation should be okay. We always use that word moderation, though again, could impact cardiovascular effects and increase bleeding when platelets are low. So good to know, like there is start of the explanation of what is happening here mechanistically. Um, and then he said I wouldn't drink more than in mild or moderate amounts. Again, what does that really mean? What we advise in general is that if you are going to consume alcohol, no more than one serving a day for females, no more than two per day for males. Hopefully that's helpful. I know I owe some more answers to that. So in general, with dietary supplements, it really all depends. It depends on you. It depends on the supplement. There's so many product formulations that we just need to answer that on a case by case basis to give you the best information and answer possible. Sometimes supplements are beneficial if there is a clinical indication. So if someone shows that they have a clinical deficiency, or if they have a condition that requires them to meet a higher need in terms of some of their micronutrients, and maybe they're not eating enough, they just can't, right? So that's sometimes when we do advise that. I generally, across the board, I do recommend that anyone who's diagnosed with multiple myeloma assess their vitamin D levels and then supplement accordingly. So there's some pretty good data that almost half of individuals diagnosed with multiple myeloma are deficient in vitamin D. And why is that a problem? Well, there's good evidence that vitamin D plays a role in differentiation of malignant multiple myeloma cells. So we want to make sure we have enough vitamin D to help in that process. Vitamin D modulates the immune response, and it also potentially exerts synergy with conventional treatment in the world of multiple myeloma. So again, I think the big takeaway with dietary supplements is ask your healthcare provider, is this okay to take? Am I all right with this? It's all dependent on your situation. With vitamin D, can you ask? Can you ask your healthcare provider to please check your levels and see where you stand and see if a supplement would be appropriate for you? The tolerable upper limit for vitamin D is 4,000 units daily. So we don't recommend higher than that unless you have a deficiency. And a doctor says take 6,000 units daily. And sometimes that's the case if you're deficient. Okay, I'm gonna do it, I swear. We got a couple more minutes. So what if things don't taste great? They taste like sawdust. So I automatically, when I hear sawdust, I think dry mouth. So I would just encourage you to use some oral rinses. And this link will bring you towards a recipe for that using baking soda, salt, and water, but also to how to cope with some taste changes besides what I'm going to share. So candy and gum, often, and sugar-free is a great idea too. It can help kind of set the stage if you do have a dry mouth or have that sawdust in your mouth before you're going to eat, because you're not going to want to eat if that's the case, right? So if we can minimize that and set the stage for a more successful meal, that might be helpful. If this is the case, you might prefer soft and moist food. So for example, pasta with like extra sauce on top, extra pesto, extra creams, whatever it might be. Runny eggs with cheese, thinned out hot cereal, soups and stews, great this time of year. Our soft meats, right? Because there was a problem with meat with this question. So meat that falls off the bone, so it's slow cooked, right? And then our dairy for protein too. So yogurts and puddings. I think of like little mini meatloaves with a barbecue sauce, because what that's doing is improving the flavor. That barbecue sauce might kind of pop in your mouth a little bit. Um, Additionally, you might prefer sour or tart foods. So things like pickles or chutney, lemon juice, or the zest of a lemon, sour cream, plain Greek yogurt, sweet and sour sauces. If any of those work, you can incorporate them into a meal. So for example, if you have leftover chicken and you cut it up and put some Greek yogurt or even some chopped up pickles in it, that's gonna carry the meal so that you can eat the chicken. Okay, just for an example. If you are still struggling and you're like, I'm not eating enough meat, this is when we might consider something like a protein supplement or smoothie to help get the protein in, and that's where a dietitian can help. The other thing I would share is I would consider new foods that you never liked before. You might actually find them appealing now. And I also would not force your favorite foods because you might develop a permanent aversion to them. So don't force it. If you're like, I repeatedly tried, it's not going to go, right? So just leave it off the table for now. Observe what does taste like it should or kind of tastes okay. What properties are there to that food? Is it creamy? Is it cold? Is it crunchy? Is it salty, sweet, whatever it might be? Is it like this pop of flavor? And then you might be able to explore how to use that in other menus and recipes. And again, that's where dietitians can help. I spent a while there. All right, a couple more questions.
Lori, I
With
just
that,
want to be mindful because it is
yeah.
8:27 here, and
Okay.
you've done such a wonderful job with so many questions. And I know that
Thank
some
you.
people may be starting to fade just with the evening. And
Mhm.
I had a question in the in the chat. So if it's okay, I
Okay.
just want to ask the question from the chat in case that person needs to hop off, and
Yeah.
also just say certainly understand if other people need to hop off.
Yeah.
If you do, thank you for being here. If you have been in the group with me, thank you so much for the years we've been together. Um, but we'll record this as Lori finishes up, and I'll send out a link for that as well. So, but just this question that somebody asked before you move to the next topic. Um, so this person said, I understood that as we age, our capacity for digestion is diminished. What can you say about digestive enzymes? How can we know if they would be helpful for optimal nutritional absorption?
Good question. So if you have symptoms of like bloating after eating, that might be a sign that maybe you can use some enzymes, or gas. Um, that could be a sign that you might benefit from enzymes. Enzymes are pretty low risk as a supplement. So as I call it a supplement, over the counter product, I would say it's pretty low risk. Check with your healthcare provider. It wouldn't hurt to try them. With digestion, I think like integrate all of the things, right? We know that activity, again, that little walk after eating, sometimes that helps induce peristalsis. So that can be important too to consider. Lots of fluids, lots of fiber. And there are some other things to explore if you wanted to, again, with a dietitian, like probiotics that might improve gut motility. Otherwise, I think like specifically to the enzymes, hopefully I answered that question. Okay. I think it would be relatively low risk and worth a shot and see if that helps. If it doesn't help after like a week, then maybe explore that further.
Awesome. Thank you. All right, let's talk
Thanks.
about diarrhea.
I love to. So there were a few questions about this, right, with the Revlimid, and can probiotics help as well? So if someone has diarrhea related to Rev or any treatment, we tend to like across the board just recommend less insoluble fiber. So that's like the roughage, right? That's like the salad, the nuts and seeds. That's the peels of things, celery. That's the really coarse texture of our plant foods. That's tough to digest, right? Especially if there's some inflammation. We do find that some people develop a temporary lactose intolerance, or with aging might become lactose intolerant. So we're gonna like drop the lactose, find suitable alternatives, or take a lactase enzyme so that they can better digest them. And sometimes fat is the culprit. So a food journal can be very insightful to help people observe their responses to foods and what their triggers are. And sometimes I encourage that with people because these are very blanket kind of recommendations. And you might be fine with lactose. So I wouldn't want you to cut something out that isn't causing a problem, right? So consider how you are as an individual tolerating some foods. Think about how much, right? So sometimes that's certainly the case with lactose intolerance. Sometimes people can't even have a drop of milk. Some people are fine with milk if they eat something with it, right? So just consider how individuality plays in here. We do recommend soluble, or what we call viscous fibers. And what they do is they soak up water, and that helps to firm up stools and slow down digestion. So that's what we're after with those types of fibers. So they're highest in oats, banana, white rice, and cooked potatoes. Probably familiar with that. And so once somebody finds that maybe these are therapeutic and helping, we might incorporate them as part of meals. I had someone once take a banana with her everywhere she went, just in case if she was going out to eat or just meeting with someone, she would just pop that banana in case, because it sort of serves as like that foundation to help her digest the rest of what she might be eating a little bit better. And then we can also expand on this, like chicken and rice soup, right? Or rice crackers or rice cakes, lots of options. Some people I work with, as long as we get the go ahead, they'll try medicinal fibers like Citrusel, Metamucil, or Consul. These are examples of soluble fibers as well. So they mix a teaspoon into something like applesauce, also pretty high in soluble fiber, or oats, and they'll take it 3 times a day. They might start slow. They might only do 1 teaspoon in one thing once a day. And then if they tolerate that, okay, they'll go up to 2 the next day, go up to 3. So they kind of taper. When you do that, what happens is it's sort of like, again, it kind of forms this like this gelatinous, viscous, like bolus, as we would call it, as it travels through the digestive tract. So it slows things down a lot. We would want to wait to drink fluids because the fluids are going to push that down quicker. We also would wait to take any medications around that because it could glop together with the medication and sort of bind it and not allow you to absorb your medication properly. So we talk about that a lot too. So if you think that that's something worth trying, I would encourage it. It's going to give you more fiber, and it's a pretty, again, low risk intervention. And it's going to give you some applesauce and oats, for example, too. Um, the part of the question, which I didn't include, was about hydration. So sometimes, like in the effort to maintain hydration because of diarrhea, we might become like hyponatremic, where we lose, where we dilute. We're filled with so much water that we're going low in our electrolytes, like sodium, for example. Now, as it stands with hydration in general, a good rule of thumb is to try to drink half of your body weight in fluids. Remember, all forms count. So if you have a cup or two of coffee, technically that hydrates. If you have broth, if you have tea, if you have soups, if you're having a smoothie, yogurt, a lot of these foods are a really good amount of water or fluid, and so they count towards the total. Okay. You can evaluate your hydration status using our good old color chart. So you can like put this on your fridge or in the bathroom and judge for yourself, where are you in terms of your hydration level. I would say, like, in terms of my experience with working with people, I would say anywhere from like 1 to 3, even 4 maybe is acceptable. We don't need to have pale urine. I would say, and according to time of day too, you might notice different changes in terms of color. But as soon as it starts to look like apple juice, then we know you're probably dehydrated. Okay. So just using that color chart can be very helpful. If you are losing fluids from diarrhea, in addition to that baseline half of body weight in fluids, I want you to, every episode of diarrhea, have a cup of water so that you're replacing the fluid that you lost from the diarrhea. Okay, that'll help you stay hydrated. Now, a lot of people sometimes will use electrolyte uh, replacement drinks, and I'm going to talk about that. So if you happen to be noticing you're getting blood work and your levels for sodium are low, talk about that with your healthcare provider. Should I be doing anything? Should I be taking like a salty broth? Should I add some salt to my meals? See what they advise for you specifically. You may benefit from including salty broths or what we call oral rehydration solutions. And I'm going to share like homemade recipes for them in a moment. I often find I recommend salty broths like regularly for people because they're just sort of they're a vehicle to give some nutrition, but also hydration at the same time, and certainly keeping that sodium level up if we see it's low. There are over-the-counter products like Drip Drop. Gatorlyte is sort of new to the market. Liquid IV, unflavored Pedialyte. You could make your own. These products are sort of formulated specifically they're designed in a way that they have a similar osmolality to what's in our gut. And so we absorb the fluid better because of that, because it's kind of evenly matched. Um, homemade options are always a go-to as well. So you'll see on here, these are some options that some people I work with have tried. And certainly I think of that baby rice cereal that you really thin out, and like how that would be so soothing to a very irritated gut for sure. That would be a great remedy for that. But again, it's in the right proportions in terms of the sugar that's in it and the salt and the liquid so that it gets absorbed best. Now, with probiotics, they are sometimes indicated if someone has a certain condition like antibiotic-associated diarrhea, traveler's diarrhea, IBS with diarrhea, or constipation, C. diff-related diarrhea, but we don't really see any indications for chemo or treatment-induced diarrhea, except for pelvic radiation might be the exception there. So we don't really know for Rev if it's going to help. If you want to learn more, there's a great website. They update it annually, the US Guide to Probiotics. So it lists all the different probiotics on the market. And then it lists the level of evidence for the indication. So maybe it's IBS. And you can see, and maybe that's part of your medical history, so you can see which one helps for what. It cites the research. It's something, again, helpful that you can maybe print this off and bring it to your healthcare team and say, do you think I can take this? Would this be okay? Eating food forms of probiotics are always safe, right? So fermented dairy, other fermented products, a great way to add some probiotics as well, just to kind of reinforce your gut integrity as well. Okay. I have a lot more to share about that, but we don't have time tonight. All right. So what about this one came in late? What would you suggest for high cholesterol? And then what about staying on a Mediterranean diet? So the best way to lower LDLs is to have a whole food plant-based diet. What do you know? So it's high in fiber, but specifically if you include 5 to 10 grams of viscous fiber per day, and that's what's on the slide there, that's been shown to lower LDL, including 2 to 3 grams of plant sterols and stanols. They're in some foods, but we don't eat a lot of it, so they fortify products. So Benecol is a pretty popular one. They have some chews, they have it in their spreads. That amount has been shown to lower LDL as well. It's important to think about your body composition and your body weight, consuming poly and mono unsaturated fats over the saturated ones, and then limiting sugary foods and beverages. So how do we pursue this Mediterranean diet, which is anti-inflammatory? This is like a great way of thinking about it. And maybe you're unable to do all of these things all at once. So you pick and choose. And maybe you're ready to do fruit for dessert instead of a sugary sweet dessert. Maybe you're ready. We'll see. Maybe you're ready to do a vegetarian meal once a week. Like this is how you can like incrementally build and make a change in terms of your eating habits, right? It's not easy to do. I get it. So this is why we start slow. We start with something you decide you can do and you want to do, and then you build from there. Okay, so that might give you some inspiration for that. Otherwise, here's some ideas. I think do think about what you're eating and think about how can I make this Mediterranean, right? So maybe you're having eggs or oats. Maybe you can put some spinach. Have you heard of savory oats where you actually put spinach in your oatmeal? Crazy. Or a really important swap would be extra virgin olive oil instead of butter. That right there is automatically kind of elevating your diet. Incorporating herbs and spices wherever you can. Lots of great ideas there. These are snacks because I think that was part of the question too. These don't require a recipe, but they certainly are all Mediterranean for sure, right? But it's like the Americanized version. So this is doable. We have access to these foods. They're unprocessed. They're mostly whole plant foods, really super nutritious, by the way. So really great choices for anyone in the audience tonight. Another question that snuck in last minute. I'm having knee replacement surgery, was told to take vitamin D. Have you heard of that? I have not. So full confession, I have not heard of that. But I did look and see that there was a study that they administered 15 grams of IV vitamin C in the post-op period. It lowered levels of inflammation in terms of blood markers. So the authors theorized that vitamin C's ability to regulate pro-inflammatory mechanisms may reduce the need for analgesics. They also stated this, and this is very important. This is like the fine print that this is what we need to hear. This is the takeaway. More work is needed. We need to know. This is just one silly study. We don't know yet, right? 15 grams of IV vitamin C is a lot, okay? And probably not available. It might be, but you'd have to ask your surgeon, right? So just check with your surgeon, ask that question, but I haven't heard that. Maybe it is anti-inflammatory, but again, I think there's a lot of other ways that you can be anti-inflammatory in the preoperative phase, right? And then help yourself through surgery. Okay. And then last question, lemon. Love it. So lemon, we don't know of any food that prevents or treats cancer, right? So lemon included. It does have this interesting compound called limonene, which is anti-inflammatory, antibacterial, and it helps to support healing of our wounds. Really cool. Further research is necessary to know if limonene is important. Flavonoid, it's a source of flavonoids, and they are best known for their antioxidant functions. So they help protect our cells that would otherwise get damaged and potentially mutate and promote carcinogenesis. By the way, black tea is very high in flavonoids. Good old black tea, so good to know that we can get those antioxidants there. And lemon also is a great way to lift flavor while reducing salt at the same time. So I would encourage using it, even though there's not a lot of compelling data to share. These are the resources that I promised I would share, the AICR. If you want to know more about the Mediterranean diet, really fantastic website on old ways, soup to nuts, everything you need to know about the Mediterranean diet. The Memorial Sloan Kettering has a searchable database all about any dietary supplement, not just herbs, but you can see on their website a patient and a professional version of the takeaway about any herb, any diet. So vitamin D, turmeric, you can search it and it'll give you the contraindications. Good to know about them. And again, that's something you can kind of take and print off and bring it to your healthcare team for discussion. I think that's really important. And then I belong to the Oncology Nutrition Practice Group or Dietitian Practice Group. Really good website in terms of information, recipes, and all that fun stuff. All right, I'm going to stop my share and see who is still here.
You've
And thank
retained
you for
most
staying.
people. You've retained most people here. You're very compelling, Lori. Um,
Thank you.
so I want to invite people, you're able to raise your hand, or if you want, I put a question in the chat if there's any follow-up questions that anybody has. Um, let me see if I can